Good day, ma'am. I am Rachel May M. Morales, BSN 2 Section A from Negros Oriental State University, Main Campus 1. So for today's return demonstration, I'm going to perform administering rectal suppositories. So first, we're going to review doctor's order, including client's name, medication name, form, route, and time of administration. Okay, so our client for today is Miss Kathleen Joy Lobo. Medication name is Dulcolax 10 milligrams suppository. So we're going to insert 1 per rectum and we're going to give it once. And the time of administration is 3 p.m. Okay. Then we're going to review medical record for rectal surgery or bleeding. So the client doesn't have a recent rectal surgery or bleeding. Next is we're going to wash our hands. Okay, so we're going to use a rubbing alcohol. So after doing hand hygiene, we will now apply disposable gloves. Then, we're going to go to our client, then we're going to identify client, check the identification bracelet, and ask client to state her name. Ngayong hapon, ma'am. So, ako si Rachel May, ma'am, ang imong student nurse karon. So, pwede ba nako i-check imong bracelet, ma'am? Kung sa'yo itong ngalan, ma'am?
Kathleen Joy Lobo.
Ano sa aman tagipanganak, ma'am?
February 2030.
Okay. So we're going to explain procedure and we're going to be specific if client wishes to self-administer medication. So na ako diri ma'am para mag-administer ma'am og rectal suppository ma'am. So ngalan ani nga drug ma'am is Dulcolax. So para ni siya ma'am to treat constipation ma'am kay maglisod man kakalibang ma'am. So kanay siya nga tambala ma'am ato ni siyang ipaagi sa imong lubot ma'am. So kung sa may imong mas gusto, ma'am, ikaw lang mo butang, ma'am, or ako lang, ma'am?
Ikaw lang.
Okay, ma'am. So, now we're going to arrange supplies at bedside. So, we have here our supplies. We have the tissue, lubricant, rectal suppository, medication card or ticket, and extra gloves. Then, we also have here our MAR and physician's order sheet. Now we're going to close curtain or door. So now we're going to assist client in assuming Sims position and we're going to keep client draped with only anal area exposed. So matakilid ta ma'am ha kay magbutang na tag suppository. Patong tiil. Tiil. Ano? Mapikon imong tukod ma'am, patong masudlan. So now we're going to examine condition of anus externally and palpate rectal walls as needed. So ato i-check ma'am ha. So if gloves become soiled, we're going to dispose them by turning them inside out and placing them in proper waste receptacle. Okay. Okay, we're going to place it in waste receptacle. We're going to apply disposable gloves if the previous gloves were discarded. And after that, we're going to remove the suppository in the wrapper. Okay, so we're going to check first the expiration date. Okay, so this medication will be expired on January 2023. Okay, so we have here the suppository. Then we're going to lubricate the rounded end. Then we're going to lubricate also our index finger and the non-dominant hand with a water-soluble lubricant. Okay, so we have here. Okay, so we're going to ask first the client to take slow deep breath through mouth and relax anal sphincter. So, ginhawa lang ma'am sa imong baba ma'am ha, hinay og relax lang ma'am atong sampot ma'am. So now we're going to retract buttocks with our non-dominant hand, so that's our left hand. Okay, so we're going to insert suppository gently through anus, past internal sphincter and against rectal wall for about 5 cm or 2 inches in children and infants. So, ako na ibutang ma'am ha. Okay. Then we may also need to apply gentle pressure to hold buttocks together momentarily. And we're going to withdraw our finger. Okay. Then we're going to wipe anal area with tissue. Okay. Then we're going to discard our gloves. Okay. So now we're going to discard our gloves by turning them inside out. So after disposing our gloves on the appropriate waste receptacle, we're going to ask client to remain flat or on silent position for 5 minutes. So okay na yung ma'am, magtakili sa ta ma'am ha, mga 5 minutes ma'am ha?
Yes.
Okay. And then, if the suppository contains a laxative or a stool softener, we're going to assist client if the client has the sensation to defecate. So, katong atong tambal, ma'am, para man ito makalibang man ka, ma'am. So, igna lang ko, ma'am, ha, if kanang maglawas na, ma'am, or malibang na ka, ma'am, ha, kato lang limpyuhan, ma'am, ha?
Yes.
Okay. So, now we're going to wash our hands using a rubbing alcohol. And then we're going to return within 5 minutes to determine whether suppository was expelled. So, mabalik lang ko ma'am ha, mga 5 minutes ma'am, para i-recheck ma'am. So, i lang sa ko ma'am sa upload. Okay, so after 5 minutes, so ato lang i-recheck ma'am ha, if masig naggawas tong suppository. Okay, so wala lang. So, yan na ka mo balik ma'am sa kuan ma'am, flat position ma'am.
Yes.
Okay, so balik tagigda, ma'am. Okay. Kaya ka, ma'am?
Yes.
And then we're going to observe for the effects of suppository 30 minutes after administration. So, after 30 minutes, ma'am, mubalik ko, ma'am, para i-recheck na po, ma'am. So, napabakailan kinahanglan, ma'am?
Wala.
Okay, so wala na. So, if napakinahanglan, ma'am, ato lang pinduton atong collect, ma'am, o anhimi dayon ni mo, ma'am. So, thank you kay ma'am sa imong oras, ma'am, o cooperation.
Thank you po.
Okay, ma'am. So, aray na po, ma'am. recording and reporting, we're going to record administration of medication on patient's chart. Okay, so Dulcolax, 10 milligrams, suppository, 1 per rectum. Given at 3 p.m. and given once. Then we're going to place initial or signature on the medication sheet opposite the time it was administered. So here. And then we're going to record client's response in nurse's notes. So here. And lastly, we're going to report any unusual systemic effects to nurse in charge or physician.